Joining us virtually is the brilliant Dr. Ashley B., who's going to connect the dots and help us better understand our bodies as a whole system. Let's give her a warm welcome, even through the screen.
Hey, good morning. Can everybody hear me? I see now. I see my face and I see my slide, so it looks like we're good to go. I am joining you all this morning from the beautiful state of Colorado, and I have to say, I'm sad that I wasn't able to travel this year. I was able to attend in person last year, not just because I met so many incredible people at the conference, but also because for those of you who don't know, Jasmine and Frank give the best hugs. So I will have to connect with them again to get my big hugs from them. But I am Dr. Ashley Biscoe. Again, I'm so grateful to have this opportunity. And today I'm going to, sorry, let me get the, oops. There we go. So today I'll tell you just a little bit about myself and importantly, what naturopathic medicine is, because that is going to set the stage for me to explain why HS truly goes beyond the skin. I'm going to discuss several other health conditions that are associated with HS and present a root cause way of thinking about this so that we understand why they are connected and importantly, what steps you can take to support your health. So, a little bit about me. I'm a naturopathic doctor. I worked in public health, both research and public health education before getting into the naturopathic world. But I began studying HS when I was still a naturopathic medical student. It's always been a passion of mine, and it has been a clinical focus of mine in my own practice since the beginning of my career. I should also mention I am a proud Wolverine. I completed both my undergraduate studies and my master's degree in public health at the University of Michigan. So, what is naturopathic medicine? At its core, naturopathic medicine is a distinct healthcare profession that blends the wisdom of nature with the tools of modern science. So we get the best of both worlds. We believe that the body is inherently self healing and self correcting. We have this inner intelligence, but that healing process can only happen when we remove the obstacles that are getting in its way and make sure the body has what it needs. So rather than just focusing on symptoms and managing symptoms, we look at those symptoms as important indicators that something is out of balance in the body. And our job is to help restore that balance as gently and effectively as we can. And even when medications or surgery might be necessary, because sometimes they are, we're still working to support the body's natural physiology, always aiming for the least invasive approach that can safely help that person heal. I like to say that naturopathic medicine works with your body, not against it. And yes, naturopathic doctors are real doctors. We are trained to the scope of a primary care provider, and we can diagnose and treat. Just like other doctors, we perform physical exams, we order and interpret lab work and diagnostic imaging. And in several states, naturopathic doctors are authorized to perform minor surgery and prescribe medications. We go through 4 years of medical training after college, and our curriculum is nearly identical in terms of the basic and clinical sciences, but we also learn natural therapies. So we speak and understand the language of medicine, but we have a broader set of tools to support our patients. In addition to the pharmaceutical model, we also learn a lot of natural therapies. We have to complete a clinical internship and pass board exams to obtain a license. Now, the way we practice naturopathic medicine is guided by 6 principles. Of course, first, do no harm. Recognize the healing power of nature. We call that the vis medicatrix. Identify and treat the cause. We don't just care what the diagnosis is, but what's causing that disease or those symptoms. Treat the whole person, and that means not just recognizing how the body's different systems are interconnected, but also paying attention to that person as a whole, their beliefs, their values, their occupation, even their socioeconomic status. Recognizing doctor as teacher, we have a duty to serve as health educators and prevention. And I'd like to share this beautiful quote from Dr. Maxwell Maltz, who was actually a plastic surgeon, so not a naturopathic doctor, but he recognized that we do indeed have this vital force in our bodies. And he acknowledged that some of his patients healed really quickly after surgery, and he wanted to understand why. And he just acknowledges that the more we do to help this vital force do its healing work, the better health we can have. And that is foundational to naturopathic philosophy. So Dr. Maltz said, this vital force manifests itself in many different ways. The energy that heals a wound is the same energy that keeps all of our other organs functioning, right? What's keeping our heart beating right now? We don't have to think about that. The body is doing that automatically. When this energy is at an optimum, wounds heal faster. We are more resistant to disease. And so we can assume that whatever works to make more of this life force, right, this vis available to us, whatever we can do to utilize it better, that helps us all over. So I just thought that was the perfect description of the body's vital force, and explaining that we have this inner doctor, right? We all have this inner doctor, we all have a vital force, and naturopathic medicine seeks to help your inner doctor do its work. So, how do we do that? What does that look like? How do we support the vital force of the body and healthy physiology? In naturopathic medicine, we start by evaluating what are called the determinants of health. And this is recognizing that humans are dynamic. We don't live in a vacuum. And there are many, many variables that influence or determine our state of health at any given time, for better or for worse, right? It's not static. We're always kind of flowing in different states. But these determinants or foundations are the key factors that we as humans need to have in healthy balance in order to be in our best state of health. The ones on the left in blue, these are the ones that I focus heavily on in my practice. And the first five that are bold, these are considered the essential determinants. So these are non negotiable. Number one is breath, right? If we stop breathing, we're going to be dead within a few minutes. Next is hydration. If we become dehydrated, that can be fatal as well. And there's a strong dysfunction in our physiology. So there is a sort of order of essentiality to this as well. But when I evaluate a patient, I'm paying attention to each of these areas and looking for what might be influencing that person's current state of health, what's out of balance, and where can we intervene. Now, when it comes to HS, it is multifactorial and it's heterogeneous, meaning it can show up differently in different people. And there's often a genetic predisposition, but that alone doesn't explain everything. So, what we're really seeing is a complex interplay between the immune system, metabolism, environmental factors, and even the microbiome of the gut and the skin. And so when you understand HS this way, it is a reaction pattern to a variety of different variables. It makes sense that on this topic today, right, conditions associated with HS, it makes sense that HS rarely occurs in isolation. HS shares genetic influences with other condition. There are inflammatory, metabolic, nutritional, hormonal, even pharmacological triggers and microbial influences related to other conditions. And from a naturopathic perspective, I have found that there are root cause imbalances within those determinants of health that we looked at. And we have so much interconnectedness between the body's organs and systems. So, going back to that principle of treating the whole person, we can't just focus on the skin. So, everything is connected, your gut, your immune system, even your emotions. So, let's take a look at a few examples. Did you know that we have a lung brain axis? Isn't that amazing? Your lungs and your brain are in constant conversation. And it turns out the air that you breathe can directly influence your mood, your memory, and even your skin. And so when all of this complex interplay is happening, you can even see here other organs and tissues. We've got the skin, we've got the gut. There's this complex interplay. We also have a brain skin axis. The brain and the skin are so deeply connected that emotional stress can trigger or worsen inflammatory skin conditions like HS and psoriasis. And as any of you with HS know, stress is a very common trigger. I see that with my own patients. And that is because stress triggers the release of pro inflammatory mediators. We also have a muscle liver axis. Who would have thought? Your muscles aren't just for strength, they are active immune organs that can release pro inflammatory or anti inflammatory signals, which directly influence your liver and your whole body inflammation. And there's even a muscle brain axis. So your muscles can release molecules during movement or exercise that help your brain grow new cells, and it can protect against brain inflammation and even things like dementia or brain fog. So this is the big picture. When we think of HS as just a skin issue, we're overlooking the fact that the skin is deeply connected to every major other system in the body. Your skin talks to your gut, and your gut talks to your lungs, and your lungs talk to your immune system. And this is one of the reasons why people with HS are more likely to experience things like digestive issues, thyroid disorders, autoimmune disorders, etc., because your body is a whole. And it's not that you're falling apart. It's that your systems are talking to each other and trying to compensate for a variety of imbalances. HS is just one expression of that pattern of imbalance. And so, this is what we mean by a whole person approach. We can't just treat the skin without looking at the rest of the body. And because of the interconnectedness of the body and those shared inflammatory pathways that many conditions have, people with HS are much more likely to have other inflammatory conditions. In statistical terms, the hazard ratio of a person with HS developing one additional inflammatory disease is about 5.4, and the hazard ratio of developing two additional inflammatory diseases is about 3. Simply stated, individuals with HS are about 5 times more likely to develop another inflammatory disease, and the chance of developing two or more additional inflammatory diseases on top of HS is about 3 times greater. So we have to look beyond the skin. This requires a comprehensive, definitely multidisciplinary, meaning different kinds of experts and practitioners having a coordinated management strategy. Each condition listed on this slide has been shown in the research to have some sort of association with HS, some more than others. And I have seen a lot of these in my own practice over the years, especially the connection to thyroid disease, Behçet's, and type 1 diabetes. And this is really illustrating why more practitioners have to become HS aware, because people with HS are going to be showing up in the office of the ophthalmologist, right? The eye doctor, the rheumatologist, the gynecologist, the endocrinologist, not just the primary care provider or the dermatologist. And so for today, I've selected a few of these areas to discuss in greater detail so that we can understand the common variables and shared inflammatory pathways, which then opens the discussion for looking at common root cause imbalances from a naturopathic perspective. So, first, I wanted to mention that HS can occur by itself, but it can also be present with certain syndromes. When HS occurs in the context of other specific conditions, we call it syndromic HS. And a syndrome is basically a group of signs and symptoms that occur together and that characterize a particular condition or disease. With these syndromes, there is a combination of genetic influence with shared molecular pathways that drive inflammation. And I just wanted to mention these briefly because they are recognized in the medical research and by clinicians, but they are considered to be more rare. And so the diagnostic criteria continue to evolve. It's not always clear cut, but because of the classic recognition of these syndromes, I felt it was important and very relevant to mention them in today's discussion. So let's talk about atopic dermatitis, which is a type of eczema. This is considered an inflammatory skin condition, and it's been gaining more recognition as a common comorbidity or co-occurrence with HS. So, with the available research looking at this connection so far, it seems to be kind of bidirectional. People with HS are more likely to develop atopic dermatitis and more likely to have already had it before the onset of HS. In both conditions, we find elevated IgE, which speaks to an allergic type of immune response. We also see Th1, Th17 dominance, which is the same pattern of inflammation we see with HS and psoriasis. Vitamin D deficiency, very common in both of these conditions. And we know that vitamin D plays a very important role in immune system regulation and having a balanced level of inflammation. Also, more common, both of these in people in African descent. So, people with brown skin are more likely to be vitamin D deficient. And I'll also mention that having worked in public health, I also suspect there are some socioeconomic and maybe even environmental factors causing the greater predominance of this overlap that we see in Black Americans. Psoriasis, incredibly common with HS. And again, just like with that dermatitis we just saw, there is an interleukin 17 predominance. That's a pro inflammatory cytokine. And also, TNF alpha is another key inflammatory mediator. The biologic drug Humira acts by helping to suppress TNF alpha. So that's a main drug target. Smoking is a major risk factor for both of these conditions. And both of these conditions are greatly aggravated by mechanical friction and rubbing. Alopecia areata, which is autoimmune hair loss. It can show up in patchy circles like this. Sometimes the hair loss has kind of a snake-like or serpentine pattern, as we call it. And it can also be alopecia totalis, where there's a complete loss of hair loss from the body. Both HS and alopecia are conditions with inflammation of the hair follicle. And people with HS are about twice as likely to develop this sort of autoimmune hair loss. Again, we see this interleukin 17 predominance. Both conditions have strong associations. There's a lot of research looking at dysbiosis, which is an imbalance of the microorganisms that live in the digestive tract and even on the skin. And that really impacts systemic inflammation. So, this is a classic example of the interconnectedness of the body. Here we've got an example of the gut skin axis. And what this illustration shows is that the composition of microbes in the GI tract can either create an anti inflammatory or a pro inflammatory state affecting the body and the hair follicles. So now the cutting edge research is exploring ways to treat the gut microbiome in order to treat inflammatory skin disorders like alopecia and HS. You know, we've always done it this way in naturopathic medicine. We've always known that the gut is sort of the gateway to the rest of the body, but this is very validating to see even more research come out to specifically connect the dots about what mechanisms are at play, because that does help to optimize treatment when we understand which cytokines are elevated, which microbes do we need to be paying attention to, for example, if we do a stool test. So I love that more attention is being shown to the gut connection to the skin. Inflammatory bowel disease, Crohn's disease, and ulcerative colitis. These are classic comorbidities of HS. And so we just talked about the gut and how intestinal inflammation causes skin inflammation. And so of note here is that in addition to the TNF alpha, I wanted to really emphasize again this interleukin 17 pattern of inflammation. And this is important. So I've listed here ASCA. These are kinds of antibodies. It stands for anti-Saccharomyces cerevisiae antibodies. And that basically means that the immune system is mounting an attack against a specific kind of yeast. Here we're talking about brewer's yeast, baker's yeast. It's what makes baked goods rise. It's what makes beer bubbly. But sometimes the immune system will mount antibodies against that kind of yeast. And we see this pattern of antibodies in both HS and inflammatory bowel disease. And many people with HS have these antibodies. And when they avoid these yeasty foods in their diet, the skin clears dramatically. So, again, thinking about that immune gut skin connection. And I also wanted to mention that people with inflammatory bowel disease tend to have a lot of fungal overgrowth. And interestingly, the body produces interleukin 17 as one of its main antifungal defenses. I also know that when there's a lot of yeast in the body, the immune system can become very primed and sensitized, wanting to react to any kind of fungus in general. So I often find in my patients that when there is a significant yeast overgrowth in the GI tract, they do tend to have these ASCA antibodies, even antibodies against Candida, which is the yeast in the GI tract, and that does drive an interleukin 17 response. And so while the body is doing its job to protect against fungus like yeast, we end up producing a lot of this interleukin 17, which is one of the main cytokines that drives the inflammation of HS, inflammatory bowel disease, psoriasis, alopecia, right? All of those conditions, we're seeing this theme. And so we need to be asking the question, why is the body producing so much interleukin 17? And so that goes back to that root cause thinking, looking for deeper imbalances within the gut. So, on the topic again of inflammatory bowel disease, this illustration is showing how an inflamed intestinal lining and even vitamin D deficiency or certain triggers like gluten can cause damage to the intestinal barrier or the gut lining. And that has a specific effect with modulating the composition of microbes in the GI tract. And that leads to systemic inflammation, and then it leads to skin inflammation. People with HS are twice as likely or more to have thyroid disease. And I have seen both in practice. I've seen the hypothyroid or underactive thyroid pattern, and I've seen the hyper or overactive thyroid disease pattern among my HS patients. Note again that interleukin 17 and the TNF alpha, two of the main targets in drug therapy for HS. Polycystic ovary syndrome. So, this is a condition characterized by irregular or sometimes absent menstrual periods, high levels of androgen hormones like testosterone, which can cause excess hair growth on the face or on the body of a woman, and cysts on the ovaries because the woman is not usually ovulating. So, it's very common for women with PCOS to have insulin resistance, and that's another risk factor for HS as well. And insulin resistance is where the cells of the body have a hard time using insulin to take up glucose or blood sugar from the bloodstream and put it into the cell. When that happens, it drives the inflammation of HS and it interferes with ovulation. One possible connection here, and I put a question mark because this is just my theory, but it has been established in the research, and I've seen it in practice as well, that people with PCOS are sometimes prescribed oral contraceptives to artificially regulate the menstrual cycle. And unfortunately, some of those oral contraceptives have very strong androgen like activity, testosterone like. And so that can be a hormonal trigger for HS. So I do wonder, I'm sure there's a genetic predisposition, but I do wonder if a part of this association is that women with PCOS are given the pill, and then that pill can be a trigger for HS if that woman happens to be genetically susceptible. Type 1 or autoimmune diabetes, also very common. And interestingly, with type 1 diabetes, early in the disease, there's a protein called nuclear factor kappa beta that gets activated in the pancreas, and it damages the insulin producing cells of the pancreas. That nuclear factor kappa beta also plays a role in the inflammatory cascade of HS. Interestingly, the new medications on the market that have been all the rage, the GLP-1 and agonist medications, those are being explored to treat both of these conditions because they do seem to have some anti-inflammatory effect, and they can really help to support blood sugar regulation, which helps to manage a lot of the inflammation in these conditions. Psychiatric conditions. I think we all know that HS is one of the most emotionally devastating conditions there is. And psychiatric conditions, especially depression, anxiety, and even schizophrenia, are incredibly common in people with HS. Not only does HS cause people to feel depressed, anxious, and even suicidal, but these psychiatric conditions are also inflammatory. There is a very strong gut brain connection to mental health. And as we've discussed, there tend to be a lot of gut imbalances in people with HS. In one study, schizophrenia was found to be 10 times more common in people with hidradenitis compared to the controls. And so the clinical question is whether it's the long term inflammatory process that HS has, or are there other variables at play, and perhaps that long-term inflammation is causing neuroinflammation. Of note here, and again, I've got a question mark. This is my clinical thinking. Lithium is a medication that is commonly used to treat bipolar, and it is also a known inducer of HS. So it can actually trigger and cause HS in some people. So it's possible that that could be one more connection. Again, inflammation contributes to the psychiatric state. It's not just about our emotions or what's happening, in our circumstances. So having brain inflammation, neuroinflammation drives a lot of these anxiety and depressive type of situations, and it does relate to atopic dermatitis and psoriasis, and then of course the stress that experiencing those conditions causes will then cause another feedback loop, so we get more inflammation. And lastly, I wanted to mention arthritis. We could just say joint pain, very common with HS. Sometimes it's around the lower back area. But remember, HS is a systemic inflammatory condition. And so when the whole body is inflamed, a lot of parts can be really inflamed and painful. In a person who has both HS and arthritis, that person is also more likely to have inflammatory bowel disease, psoriasis, and even metabolic syndrome. There does seem to be a two-way association because people over 30 who have HS are at a greater risk for then going on to develop RA. And if a person already has RA, they are predisposed to develop HS later. And I have seen this rheumatoid arthritis and HS association in my practice. Um, so, what should we do with this knowledge, right? With this understanding that the systems of the body are interconnected and that HS shares a lot of mechanisms with other conditions, what can we do? What I don't want is for anyone watching this to feel hopeless or doomed or discouraged. That is not the goal here. What I want to happen is that we can understand how to support our naturopathic foundations, our health determinants, so that we can support our inner doctor, that vital force, as best as possible by figuring out what are these root cause imbalances, what's driving the inflammation in the body. And so, here again, I want to remind us of the 6 naturopathic principles with special attention to identifying and treating the cause and treating the whole person. So, how do we identify and treat the cause and treat the whole person? We go back to this list of determinants. We look for imbalances in these foundations. So, instead of just trying to get rid of the disease, we do whatever we can to create balance in these foundations. We are working to create the conditions for health. That's a paradigm shift rather than just going after the sickness. Because when we create the conditions for health, that is allowing your inner doctor to do its work. Every medical intervention, whether it's a drug, a surgery, something natural, at the end of the day, it's working on the vital force of your body. It's toning something down or enhancing something or working on your physiology in some way. But if you think about it, if you break a bone, the doctor will set that broken bone in place, but your body has to orchestrate the forces to mend it back together. So I like to think of the determinants of health as actual roots, like of a tree. And these are going to be the deepest reasons for why the body is behaving in a certain way or expressing certain disease states. Because when these roots are disturbed and out of balance, that is when the body will intelligently respond or compensate in some way. So, depending on which roots are disturbed and how many are out of balance and how long they stay out of balance, we call that the total load. That's going to influence how your body responds and what organs and tissues and disease pathways get activated as a result of your body trying to compensate for these imbalanced roots. So, when we consider diseases like HS and its comorbidities, this tree analogy helps us visualize that there are shared disease pathways and mechanisms, which results in the visible manifestation of actual diseases or a diagnosis that we can see at the top, right? This is the physical manifestation of what's happening beneath the surface. And again, paying attention to the roots is how we can intervene at the deepest level. So remember, the goal is to support healthy foundations. And I wanted to mention here that even if you choose surgery or a medication route, I think with HS, we need to make use of any and all therapeutic tools that we have at our disposal and apply them appropriately for each person. But even if you choose surgery or medications, your outcomes will be better when your foundations are supported. You're going to have better remission and wound healing after surgery. When you have a good nutrient status, medications can work better. So there's always a place to support your health foundations, regardless of what medical interventions are applicable to your situation. I want to highlight a few of the root cause areas that are especially important for HS and any inflammatory condition, and those are nutrition, sleep and circadian rhythms, which go hand in hand, gut or digestive health, and toxins in the environment. Those also go hand in hand. So let's recall that HS is multifactorial. It is thought to be a reaction pattern in a person who's genetically susceptible. And the good news is that when we do the work to support our roots, these healthy foundations, we are intervening in these key areas that are widely recognized as the main variables that tend to create the perfect storm for HS and its related conditions. So, nutrition is one area, and good nutrition works in our favor for many ways. It supports a balanced inflammatory response, a healthy gut microbiome and gut lining. We've talked about the gut skin connection. We need balanced blood sugar. That's important for healthy skin and wound healing. And that includes wound healing after surgery. And if we are eating more foods that are healthy and nutritive, we are also less likely to have foods that are ultra processed and pro inflammatory. And there actually is evidence for optimizing zinc, vitamin D, and B12 levels in people with HS, even through supplementation. There is evidence for avoiding baker's yeast and brewer's yeast, especially if you've got those ASCA antibodies that we discussed before. Avoiding or limiting dairy can be really helpful for some people. Avoiding or limiting what are called ultra processed foods. And there are actual studies that define these ultra processed foods and the implications that they have for HS. A low carbohydrate diet or even a Mediterranean style diet have been efficacious. There's no perfect diet, but the concepts here is whole foods based anti inflammatory eating. And even intermittent fasting. So, going long periods between meals allows inflammation to calm down. It helps to support blood sugar and insulin balance. And all of that can be really helpful. And then I also like to identify and treat food allergies. I've seen good results with this in my practice. And there's also evidence in the research for identifying and addressing specific food allergies in people with, with HS. I love this illustration because what this is showing is that when your body is lacking the key nutrients like iron, zinc, vitamin A, and vitamin D, your skin does become more sensitive, more inflamed, and more atopic. So remember the connection with atopic dermatitis and HS. And we can see on the left with sufficient nutrient status, things are in balance. As we trend towards the right side and in a deficient state, we are shifting towards a Th1, Th17 dominance production. And that's the thread we've seen throughout this talk. This T helper 17, interleukin 17, TNF alpha picture is one of the main inflammatory patterns we see with HS. I'll mention here, a lot of people with HS are iron deficient. There's many reasons for that. So I do encourage you to talk with your doctor about checking your iron status and getting the appropriate lab work for that. Sleep and circadian rhythms, very important for HS. When we don't sleep well, our blood sugar is not balanced. We can develop insulin resistance even after one night of poor quality sleep. That can sabotage our blood sugar for at least 2 weeks. And we have certain kinds of immune cells. They're called our T regulatory cells, and they need good sleep during the dark hours of the night in order to do their job of bringing inflammation under control. And as it turns out, people with HS are more likely to have sleep apnea. So that's disrupted breathing during the night. And so that's an important factor as well. Have a discussion with your doctor if you're not feeling well rested. And there is a set of principles that we can implement to support our good sleep. It's called sleep hygiene. And these are sort of basic habits that we can do to set ourselves up for success. One of the most simple ways is to go to bed at the same time each night and wake up at the same time each morning. We can reduce our exposure to screens. I know sometimes we have to work at night, but whatever we can do to reduce computers, phones, tablets, that blue light can disrupt our melatonin production. And melatonin is not just our sleepy hormone, it's actually one of our most important antioxidants, and it has anti inflammatory mechanisms as well. I know that a lot of people with HS aren't sleeping well because of pain and itch. So don't be afraid to have that conversation with your doctor to find solutions to alleviate those symptoms, because if it's sabotaging your sleep, that's not working in our favor. So sometimes it takes a little bit of troubleshooting to find out why we're not sleeping well. And again, consider a sleep study. HS is more commonly co-occurring with sleep apnea, and that should be ruled out. That also relates to the first determinant of breath and oxygenation, right? If we're not getting good breathing throughout the night. Gastrointestinal health, we could probably do a whole conference just on this. We've talked so much about the gut skin connection, but remember that the microorganisms in our gut influence inflammation. And when our gut lining is damaged, we have a harder time absorbing the nutrients that our body needs. Nutrition is not just about what we eat, but how well we can absorb it in the GI tract. And so I evaluate all of my HS patients for digestive function, for their nutrient levels. If there's yeast overgrowth, that's huge, because remember, yeast overgrowth is going to drive that T helper 17 response, producing interleukin 17 and all of these other inflammatory mediators that are the main drivers in HS. So, to support a healthy gut, we want to do our best to avoid the ultra processed high sugar foods and alcohol, getting good sleep, support digestion however you can, not eating in a hurry, chewing, use digestive enzymes if you need to. I know this is controversial, but it's important. So, antibiotics and over the counter pain meds like Tylenol, ibuprofen, those are critical for HS management. I get that. But in the long term, they do disrupt the gut barrier. And so I believe in the long term, they can do more harm than good. So just use them cautiously, right? And have a discussion with your doctor about if this is appropriate or necessary long term. Certain ingredients like artificial colors, flavors, and emulsifiers, reading food labels, you can identify those ingredients, but those can be very damaging to the gut barrier and interfere with our digestive functions. The hardest part is probably practicing stress resilience, but chronic stress damages the gut. And so, whether we have to maybe I like to use botanical medicine and help my patients have a more balanced stress response. Find ways of relaxation, seek counseling or therapy if necessary. There's a lot of evidence for using bifidobacteria to restore a healthy gut barrier function. There's a lot of mechanisms there. And then this is a dovetail into my next route that I want to discuss, which is reducing exposure to environmental toxins. The GI tract tissues, really anything membranous in the body, is especially vulnerable to toxic environmental chemicals, and that makes the GI tract no exception. Toxins, I think, doesn't get enough attention for overall health, inflammatory diseases, but there's a whole world of environmental medicine out there. And our planet, unfortunately, is polluted. None of us are going to completely avoid these exposures, but the goal is to understand how we get exposed so that we can reduce our exposure as much as possible and support the body in its natural detoxification mechanisms. And nutrition plays a role in that. We need nutrients, especially B vitamins, for the liver to conjugate and modify these pollutants so we can excrete them through our body. We can also sweat a lot of these pollutants out. But I wanted to highlight some of the mechanisms by which toxins are specifically linked to HS and other inflammatory diseases. Smoking increases interleukin 17 and TNF alpha. And interestingly, cigarettes are also a source of cadmium, which is a heavy metal. there is a very strong connection with mercury and cadmium levels in psoriasis in a dose dependent fashion. So, the higher the mercury or toxic metal levels in the body, the worse the psoriasis tends to be. Chemicals called dioxins and benzopyrenes, they increase hyperkeratinization, so an overgrowth of the skin cells, and that leads to follicular plugging, like what we see in HS. BPA plastic increases androgen sensitivity. So when we think about the hormonal triggers that HS can have, that's a variable as well. Air pollution, who would have thunk, right? It triggers inflammatory diseases. And a lot of these chemicals, especially in the cosmetics and the perfumes, there are safer choices out there nowadays, but they tend to drive obesity and diabetes and hormone imbalance. And then aside from environmental, or I should say man made toxins, there are some naturally derived toxins from microorganisms. We can call those biotoxins. And so, even having certain kinds of infections or microbial imbalances in the body, that's another source of toxicity. So, endotoxins from bacteria, recognized as a trigger for autoimmunity and HS. Mycotoxins from fungus, that drives that T helper 17 response. There are some wonderful resources out there. I just wanted to mention a few books and apps. I love the Better Basics for the Home book. There is a Yucca app that's really nice. Even something as simple as getting a good water or air purifier. We breathe in thousands of times a day, and all the tiny, particulate matter in the air that we don't see. Remember the lung, brain, skin, immune axis, it's all connected. So we breathe in a lot of these pollutants that get into our bloodstream and drive systemic inflammation. And then possibly working with a practitioner that can evaluate your body and your home for things like mold. I check all of my HS patients for mold because I have found that to be a big driver. Medical and chemical toxicity evaluations, mitochondrial assessment. This is a little bit more of an advanced evaluation that can be really helpful for figuring out what's driving the inflammation. So, we talked about roots, right? The basic foundations. What are we going to do about the dysregulation or the inflammation that's already been stirred up? We still want to intervene wherever we can. So, from the conventional side, the main drug targets right now for HS are heavily focused on blocking TNF alpha. So, Humira is the main drug that does that, and there's evidence for efficacy in that regard. And there's a lot of promise with these interleukin 17 inhibitors as well. The challenge, though, is that we are broadly suppressing these parts of the immune system, and sometimes that's exactly what we want. But then I worry about long term immunosuppression and what that could mean. As a naturopathic doctor, and again, you have to decide with your physician what is the appropriate treatment for you. I think there is a time and a place to go for a high force intervention. I have patients who are not comfortable with that, and we still get good results. So I'm not here to tell you how you should approach your HS. This is my perspective as a naturopathic doctor and harnessing the natural therapeutic tools that I have available and that are actually quite efficacious. So, one of the ways that we can work on reducing TNF alpha, there are many botanicals like turmeric, boswellia. Again, there are evidenced pharmacological actions. They have constituents in these botanicals that act on the physiology in a way that is less suppressive and more so modulating or balancing. And that's what we want. Modified citrus pectin, which is actually the white pith of the citrus fruit, when it's dehydrated and hydrolyzed, it develops certain molecular properties that are highly therapeutic. I could do a whole lecture probably just on modified citrus pectin, but I use it for so many things in my practice, and it is one of the things that helps to modulate TNF alpha. From a root cause perspective, I think about what's causing the body to want to respond with TNF alpha. And so I'm looking for things like infections, toxins, nutrient levels, and sleep quality. How do we modulate interleukin 17? Again, some wonderful botanicals, Chinese skullcap and rosemary. There are so many more that I could mention, but these are two of my favorite. And the beautiful thing about rosemary is that it's a nootropic herb. So it has an affinity for the brain. It increases blood flow to the brain. It's really good for brain fog. And it does have anxiety and mood enhancing benefits as well. From a gut health root cause perspective, we want to do a stool analysis and make sure that we have healthy gut bacteria producing short chain fatty acids. That helps to nourish the intestinal barrier. There's research to support Bifidobacterium infantis as a strain of probiotic that helps to modulate interleukin 17 and then address that dysbiosis. Again, if there's chronic fungal overgrowth or bacterial overgrowth, the immune system is going to keep feeling the need to respond with interleukin 17. And what about the leaves, right, at the top of the tree? The actual symptoms, the diseases, the skin, right? We want to deal with that as well. One of my favorite botanicals that is gentle and soothing is chamomile, believe it or not. Chamomile is cooling, it's anti inflammatory. And when I say chamomile, I mean truly just a simple tea. The medicinal compounds in chamomile actually are water soluble. And so, something as simple as brewing chamomile tea and using it as a skin rinse, as a compress, it can be incredibly soothing. This is what we call a vulnerary herb. So, herbs that are vulnerary have wound healing properties, and chamomile is one of those. Anti-itch, antifungal. When taken internally, chamomile is also very calming. So thinking about the anxiety connection with HS, that could be really therapeutic as well. Just use caution if you have allergies to anything in the daisy family, because this could cause a cross reaction. And while I'm on that topic, I want to mention that I don't recommend going out and taking a bunch of herbs and supplements without first working with someone who knows how to implement those for you safely. Because just because something is natural doesn't mean it's safe, doesn't mean it's high quality. And there can be certain interactions with your existing medications or existing diagnoses that you have that could be contraindicated. And some of my other favorite skincare tips, I think everyone who knows me knows that I'm such a fan of Manuka honey. My favorite kind is from Manuka Med USA. They have great products and they're a great company. I also love Defense soap. This is available online right from their website. But what I like about Defense soap is that it has eucalyptus and tea tree, so it's soothing for the skin, and it actually helps to break up the cell wall of actinobacteria. Actinobacteria can colonize the skin. It's very inflammatory. It can even cause some of the draining and the abscesses. And in the research studies, it has been found that there's more actinobacteria in the skin folds of highly inflamed HS areas. Hydrotherapy, aka using water. So I advise my patients to take a lot of warm baths, and they love it. Usually, it's a part of their daily ritual. Not only is it emotionally relaxing, but the warm water supports healthy blood flow, wound healing, and just a lot of soothing relief. Derma E makes great products with tea tree that can support less inflammation, less itch. And then I also recommend wearing soft, breathable undergarments and clothing. With both psoriasis and HS, friction, mechanical friction and rubbing is a cause of, a trigger. So we want to be mindful of not wearing anything too tight or anything that's going to cause the skin to sweat and not be able to breathe. And I know that we covered a lot. I had 45 minutes and I feel like I could have just kept going. And you might be feeling overwhelmed with all of the information you've learned, not just in my talk, but from yesterday and today. And I just wanted to leave you with this quote. Do what you can with what you've got where you are. Healing is almost never perfectly linear. It's more like peeling back the layers of an onion. And yes, sometimes we cry during the healing journey, right? There's a lot of disappointment. There's a lot of things that sometimes aren't answered. And so I don't want you to think that you have to have this all figured out now. Think about if there's one thing you can take away, maybe you'll think about getting a nice air purifier for your home. Maybe you'll look a little more closely at the personal care products that you're using and decide to get the Yuka app and start gradually changing out the products you're using for things that are less toxic. Just do what you can with what you've got where you are. And if you are interested in exploring this root cause approach to medicine, I would encourage anyone to seek a naturopathic doctor. There are naturopathic doctors all throughout the US and even in Canada. Just make sure that that person has attended a 4-year accredited naturopathic program, because there are people out there who call themselves naturopaths, but they are not real doctors. They're more traditional or lay naturopaths. So, whoever you choose to work with, just make sure that they've passed board exams and that they have a license to practice. You can go to the American Association of Naturopathic Physicians. You can do a local search for naturopathic doctor near me. Most states have a naturopathic doctor association. So I've listed the Colorado one here. Michigan has an association of naturopathic doctors, and so does California and Texas. So that could be another way to find a doctor. And if you have questions for me, you can visit my website, you can call, or I have a contact form. And I appreciate your time and attention, and I would love to open the floor for questions.